Hi, my name is Callum Roberts. I'm a doctor from the Newborn Intensive Care Unit at Monash Children's Hospital. Some of the most vulnerable babies that we look after in the Newborn Intensive Care Unit have a condition called congenital diaphragmatic hernia, or CDH. These babies can be extremely unstable when they're born, and in some cases, when it is most severe, they may not survive. The problem with babies with CDH is that the diaphragm, the muscle between the chest and the abdomen, doesn't develop properly during pregnancy, which means that some of the organs that should be in the abdomen move up into the chest, meaning that the lungs are underdeveloped and don't function as well as they should do. These babies can need a lot of help at birth, and we are interested in trying to find out how we can provide that help more effectively to improve their outcomes. Under traditional circumstances, what we would do when a baby with CDH is born is to immediately clamp the umbilical cord and provide breathing support at a specialized resuscitation platform over at the side of the room. Now, research done here at Monash and at the Ritchie Centre in the Hudson Institute of Medical Research has suggested that there may be a better way to provide help for these babies at birth. The way that we can do that is actually to provide the breathing support and get air into the lungs before we clamp the umbilical cord. Now, in order to do that, we need some equipment which will help to make that easier, and that's what you're looking at here today. This is called the Concord Trolley, and this trolley is something that we can wheel over and position directly over the mother as she's giving birth, and once the baby is born, they can be placed onto this platform here, where we, as a neonatal team of doctors and nurses, can provide the baby with all of the help they need in terms of breathing support while the umbilical cord is still attached and there's still blood flowing from the mother's placenta. Preclinical research done here at the Ritchie Centre suggests that this might actually help these babies and improve their outcomes. This Concord Trolley is the one that we have just received on the boat from Europe, and will allow us to do some further research with the babies in Monash Children's Hospital to see if this approach is going to improve their outcomes. I'm really happy to say that this particular Concord Trolley has been funded by money that's been provided by CDH Australia. So we're extremely grateful for that trolley being provided. It's really going to help us to perform some really valuable research and potentially improve the way that we look after these babies. Okay, I'll give you a closer look at what this Concord Trolley looks like. So I'm going to start by showing you here. Down here we have the platform where the baby will rest just after being born. This can turn out so it's in the correct position. The baby will lie here, and you can see this notch where the baby's umbilical cord can sit without being put under any tension. This is movable up and down to make sure that we get it to the correct height, and it's sitting just above the mother, who'll be lying in a bed. Of course, we need to keep the baby warm. We'll be able to mount a heater just here, which will sit over where the baby is and make sure that the baby stays nice and warm. And in any neonatal resuscitation or stabilization setting, we also need to have monitoring so we can see what the baby's doing. And so all that monitoring for looking at heart rate, oxygen levels, and anything else that we need to monitor will be attached just here, where we have plenty of room to attach the monitoring. And we haven't got that all attached just yet because this is literally just out of the container very recently, but that will all be on the way for when we are ready to begin doing the clinical research that we'll be doing with this device. So thanks very much, and I look forward to telling you more about the results of the research in a year or two's time.